Good morning, sir. Thank you for joining on board. So my first question to you is, how can we improve functional outcomes such as speech, swallowing, nutrition, and quality of life among oral cancer survivors in India?
Okay, so I'm Dr. Pravesh Mehra. I'm the Director Professor for Oral and Maxillofacial Surgery and the Head for the Department of Dental and Oral Maxillofacial Surgery at Lady Hardinge Medical College, New Delhi. Now, if you want to increase the functionality in cancer survivors, the first and the foremost thing is, as clinicians, what do we call as survivors? Anyone who has lived after his treatment, or still he's undergoing treatment, or if he's got a recurrence also. So anybody post-diagnosis till the end of life would be called a cancer survivor. Now, as clinicians, the main problem is that we might cure the person from cancer by surgery, radiotherapy, chemotherapy, but the problem comes in the post-therapy phase or during therapy phase, when especially in oral cancer, what we treat, you find the patient cannot open his mouth, there is severe scarring there, there is loss of his teeth part or the edentulous part or the mandible or the maxilla part of it. There could be burning sensation inside his oral cavity. So there are multiple issues that are there. Now, it is not one treatment that would solve it. Okay? So when we want to handle these fellows up, what you require basically is a team approach, what we call a multidisciplinary team. I will not call it a multidisciplinary group approach, because you should know what is a team and what is a group. So it's a team approach which is required, which is defined objective or outcome required for the patient there. Now, whoever is coming in there. So starting from the surgeon, the maxillosurgeon who's there, with the hygienist who's the dental hygienist who's there, a medical professional who's there, could be an ENT colleague who's there, an oncologist who's there, or a radiotherapist who's there, including the family support. That is the most important thing. The family and the close friend support is the most important thing. So you will have to have these fellows go up and interact with patients who have survived already cancer, or who are facing these problems of post-op effects of cancer. So there is no one, I would say, lucky that this is the treatment during a cancer survival phase. No, it is not there. What it requires is a proper counseling and giving the patient to understand that he is going through a new normal. It is not the normal that he would want previous to the surgery or previous to cancer what he was there. He will have to create into a new normal thing, and he has to understand that is a new normal for him to stay during the life. And that's more important, to motivate him to, because you see, health is not about only physical disease. It's physical, mental, social, spiritual, and financial also. And especially when a person survives cancer or he's got cancer, it is not him. His family also is suffering there because of it. Thank you.
Thank you, sir. Thank you for your response. My other question to you is, what policy measures can be introduced to strengthen long-term care, rehabilitation, and support for oral cancer survivors in India? The policy suggestion, sir.
Yeah. So, as we talked about the cancer survivorship and what are the problems that are there, what are the gap areas, I think cancer survivorship has never been into a thought of area in any programs of the country. It could be a national prevention cancer control program or in the oral health program. So we will have to think about providing a type of a sub program or a separate program under the cancer control or the oral health also for oral cancer patients, especially if you want to treat them. And that would include basically one thing that should be there. It should be more of a community approach and more of advocacy approach. There should be some platform where all these patients should come up and interact or disclose their feelings, their sufferings, or their inhibitions, or whatever they feel like with their fellow colleagues who have survived cancer or who are living with cancer. That's the most important thing to do.
Thank you, sir. Thank you for your responses.